Hello, welcome to this tutorial on how to process blood for platelet-rich plasma therapy using the VPET system from Paul Corporation, Paul Life Sciences. Okay, so this device has been around the market for quite some time, and what I'm going to do is go through how you process it, but some tips and tricks along the way to get a better sample out at the end, and how to avoid certain complications with it. So the actual kit, it's a self-contained kit. This is the kit that you get from your wholesaler or from us at Nupsala. And it's all that's required for processing platelets for platelet therapy in all horses, dogs, cats, or any animal species that you're going to be using the platelet therapy for. Principally, what it's going to try and do, is actually capture the platelets. So this is not PRP, this is actually PET, which it stands for platelet enrichment therapy. There is no plasma component on this. What actually is going to happen, because there's no centrifugation involved, is that the filter, and all the technology is here, it has a mechanism of capturing the platelets and removing those platelets from the whole blood so that you can then harvest those platelets into a solution to give you a concentrated platelet a solution which you can administer. So the self-contained kit, it's a very, very simple to follow kit. In fact, when you open up the box, it contains all the instructions that you need, and it really is a simple guide to processing it, and that's what I'll take you through now. So your preparation, when you take the actual VPET kit out, it comes in a sterile container. Everything is obviously sterile. You would open it up aseptically and prepare it. It's a closed system. So what it can do is allow you to operate stall side. If it was a horse, you can obviously create a small sterile field to which to process it. I quite like using this little vice device that we just got off eBay, or I think it's eBay or Amazon or something. It's not a medical one, it's just a simple at-home one, but it's a very efficient way, especially using these collapsible tables to create your little space as I have done here. So when you take out the packet, the first thing you're going to have to do is the clamps which are on the system, these white clamps here, make sure they're shut. This is really important. Clamp them shut. So there's a top one and a bottom one. So just pinch them together and they're shut. The reason for that is, and this is one of the first things that could go wrong with this bit of equipment, is that if you put the first solution into this bag and you haven't clamped this, it's going to run straight into the filter. And unfortunately, at that point, it would destroy the filter. It won't be able to process the blood. It works by using blood. It doesn't work by allowing this solution to go through. So really don't make that mistake. Otherwise, it's a bit of a costly mistake. So clamp your two clamps off, making sure that they are secure, and just hang the kit up. So if you follow the instructions, what you've got is solution A, B, and C. And these are all contained in the tray. Here's the bottles labeled A, B, and obviously C. And it's quite a logical process. So the first thing you're going to do is take 9 mils of solution A. Making sure this is clamped, double check. Take your cap off the lure lock. Now these lure locks work by pushing and screwing in tightly. I can't emphasize how important it is to open up these lure locks properly. And then make sure that's closed. Enter the first solution. And that's the kit primed. Okay, close that off. The next thing you're going to do is preload your 60 ml syringe with the anticoagulant from B. And as the instruction says here, it's 5 mils in a 60 ml volume. Okay, you're then going to take the blood from the patient, prepared already, is you're going to take 55 mils of patient blood with the 5 mils of the anticoagulant, making a 60 ml solution. I use these little secure caps, so obviously when I'm working this area, I would then take off whatever device you're collecting the blood with, and then put these little secure caps on these lure lock caps, just so you can transport it a lot easier and obviously maintain sterility. Is remove your cap, remove the cap from above, and again lock in your lure lock device and transfer the blood into the top bag. You know it's the top bag because it's only the top bag that has a port on it. The bottom bag, which is a waste collection bag, has no port, so you're not going to get it the wrong way round. And again, just for thoroughness, put your cap back on. Okay, now this is a very important step. When we've got the blood in the top bag and preparing it, is you've got to allow your platelets and the blood to take on that initial A solution. So what you're going to do is mix it and really take the time. Don't rush this phase. Take the time to allow the A solution and your blood to mix together and for all the cells to take it on. It's a very important process. The manufacturers talk about agitating it backwards and forwards several times like this. For me, I also like to make sure that all my blood and anticoagulant is mixed together. I don't want any clots because that can also be a complication when we get down further into the filter. So really take the time to massage. I prefer to massage this bit here. And again, this leads to a better final product. So don't rush it, take the time, make sure that it's all mixed together. A few more steps and we'll be ready to go. Okay, I'm confident that that's all mixed together now. Hang it up. And what we're going to do now is we're going to open the ports so that the blood can drain through the filter. So what we do is we open the bottom one first, not the top one, because if we open the top one, it's got nowhere to go and it creates a bit of a blockage. So what I'm going to do is the bottom one gets open first, then the top one, and the blood will flow freely through the filter. If we turn it around, you can see it's already whizzed around the filter, and very shortly you'll start to see the blood process through into the waste bag. Here it comes. Okay, in a warm environment, this would take approximately 10 to 15 minutes. I have done them where the process faster. A word of warning, if you're doing this in a cold environment, especially outside, it will take a lot longer. The blood will move slower when it's cold. So what I tend to do is either move it inside or put it into the car, wherever, or your truck, whatever you're working in. So just allow the speed of it to go through. Avoid the temptation to force it. Do not force it. What's happening is as the blood's going round, it's going through almost a tortured path. So your big cells, if you imagine sedimentation, your big cells are tumbling over and they are going out. So your big red cells are obviously tumbling over and going down into the waste collection bag, where those really small cells like platelets are taking the tortured path. And it's a very complex mesh program inside the filter. It's also a positive charge that's inside there. So there's a way of attracting the cells at the same time. So if you try and squeeze it in to try and make it faster, you're disrupting that process. Do allow it to process in its own time. So in preparation for the next step, what you're going to want to do is to get ready with the next syringes. So in accordance with the instructions that's on the bag, what you're going to be doing is getting a blank syringe, and with solution C is getting a flush solution. So that's what volume C is, a flush solution, and that's 8 mils. So you're going to take 8 mils from vial C, and when it comes to it, we're going to be connecting it. So your solution C, this final solution here, is what's going to back flush the filter and collect up those platelets. So this is what's going to be transferred into that final syringe. And when the blood is finished processing through the actual filter device until it's all complete, we'll then go through the phase of locking it off. So here we have most of the blood now has gone through from the top bag, now entering the final stages through the filter. If you turn the filter around, you can actually see as it starts to obviously empty of the final bit of blood, and we want to give it that time to make sure that it has had the opportunity to get rid of any extra blood, because if we don't give it that opportunity, there's a chance that we're going to be flushing back some whole blood into our final preparation. So we'll just wait a little bit longer. Looks like it's all gone through. I always like to just to give it that extra bit of time. Sometimes I actually see a space occurring here, not always. I'm not really getting anything coming out now into the exhaust bag. I think that's pretty much drained now. Okay, right. So we're now at the harvest phase, the collection phase. So what I'm going to do now is shut it off. With those two clamps, the filter is now secure. I take it off my hang, and what I'm going to do now is prepare it for the actual collection. The first one I do is my harvesting syringe. This is what the preparation is going to go back into. Now, all the mistakes I've ever seen with this system, it is because this step is not carried out properly. Take the cap off the lure lock. With this syringe, you want to break the seal on the syringe, okay? So the syringe itself, normally when they come from the manufacturer, they would have a little bit of space here. And if you ever popped it, you always get that little bit of a pop when you first use the syringe. So just break that little bit of a pop. And what we're going to do is we're going to place that onto the lure lock. Okay, this needs to be screwed on as tight as possible. Don't just put it on halfway, okay? Because you need to open that lure lock. Otherwise, you're going to create a negative pressure. So really screw that on. Make sure that's on really, really tight. And then with your harvesting solution, okay, you're going to connect that to the bottom port. Again, make sure that is screwed on very, very tightly. Right, and in one movement, we're going to inject back into the filter, thus flushing all the platelets that have been captured into our capture syringe. At any time, if you feel resistance as you start to push, do not carry on pushing. It's because you have not put that syringe on properly. If you have any resistance, and it's going to be really free flowing, you're going to see it in a second, any resistance means the syringes are not connected to the filter correctly, and you will crack the filter in half, releasing, unfortunately, the contents on yourself. And that's a user error. It's not a product error, it's a user error, because you've created so much negative pressure by not opening up this. You're effectively clamped off, and you're forcing fluid into something that's not going to take that fluid. So there's only one place it's going to go, and that's out. All right, so with this now secured on nice and tight and open, I'm going to just do one swift movement. That's it. No resistance at all. Remove your syringe and connect a bung so it's now safe and ready to use. You now have an 8 ml volume. Obviously it does look like blood. It looks like you've basically just processed blood and blood comes out the side. There are red cells in here. In fact, if you just spin it down, it actually contains very few red cells. Although it looks very red cell tinged, it's not that bad. And that's because there was just a little bit of blood, obviously, in the ends of the tube. And the actual filter process itself does use a few red cells in the overall mechanism of creating that tortured path. So don't be concerned. Some platelet-rich plasmas, if you've ever used it clinically, are very plasma color, that nice clear yellow color. This is not a PRP, it is a platelet enrichment. So what you've got is that final solution which we injected, plus the platelets and cell content of that filter. As you can see, all of our blood is in the collection bag at the bottom. But if you were to process the platelet count on this, typically this would get anywhere from a 5 to a 7-fold increase. That's what we find in equine and in canine. What makes a difference to get a bit of a higher yield of platelets is obviously that massaging bit first, because you want to make sure that the platelets don't clump together. They're the optimal size for the filtration process, and that's what that step is for. And also when we back flush it, do it in one simple movement, because what you're doing is releasing those platelets from the filter mesh into that final syringe. So don't overly flush it, don't give it too much force, but equally don't do it too gently. Just one efficient, free moving flow into that syringe. So here is our PRP ready for use. Okay, the only other thing which I will talk about briefly is if you don't use all of it or if you want to freeze it. There is a freeze-thaw process on the Nupsala website on how to follow, but again, this is something which we get asked a lot of questions on. How do I prepare it? If I were going to freeze the PRP or the PET, I typically carry these vacutainers. These are red top ones, which means there's absolutely nothing in them. These are just plain tubes. What we can do is transfer our PRP or a PET into these tubes. And I really like these for freezing. I don't like just syringes. I know some people freeze just syringes. I prefer it to go in here. It's easier to carry and handle. And obviously I keep them sterile. So if I'm gloved, I can obviously handle these. Okay, when you have handled the frozen PRP, what's the freeze-thaw cycle? Okay, when you take your sample of PRP out of the freezer, obviously frozen, make sure it's warm. Okay, so what you're going to do is warm it up, normally in body temperature. Just holding it for a few minutes will actually bring it up and thaw it. But you want to make sure that there are no ice particles. So really bring it up to almost body temperature so that you're ready for the process. The process is, if this were my PRP in here, so I was to transfer it once it's frozen. And it's important that you only do this with frozen PRP. And that's because our platelets in here are still intact, which means if I was to push it through a filter, it would actually get clogged by the filter and I'd get nothing through the other side other than solution. The freeze process actually activates the platelet, allowing growth factors, and growth factors do go through. So if I was to take my PRP that I've harvested and taken out of my syringe, the first thing I'm going to do is, if I just bring this to the camera, what you're going to see is the syringe to a 5 micron filter. This is the first thing that we're going to attach to our syringe. And that takes out the big junk, the big bits of particle, big cell debris. The next one you're going to do is a 0.2 micron filter connected to an LL connector, connected to the syringe that you're going to use. What this does is connects a closed system, allowing you to filter bigger, smaller syringe. And that ensures that if you've taken a frozen platelet sample and you're going to use it, you've essentially cleaned it up, having been activated. And what you get through the other side is your solution and the growth factor proteins ready for collection. Like I said, further guidance on that can be found on the Nupsala website on the freeze-thaw process for frozen PRP. If that was bone marrow aspirate concentrate or stem cells, obviously that wouldn't apply because we always want to keep those cells intact, and the freeze process would obviously lyse those very important stem cells. So this only really applies to any platelet PRP type device. Doesn't matter if it's the VPET or other PRP. If you wanted to store PRP, this is my recommendation for making sure that you can obviously clean it and then you are good to go. Having gone through a 0.2 micron filter, you know there's also no bacterium, especially if it's going into an articular environment. The reason we use the 5 micron filter, big filter here, is that all too often you can clog these smaller filters, and what we don't want to do is lose any of our platelet therapy. We don't want to use platelets by clogging a filter and then having to throw that away. So I normally find that this is the secret to making sure that we only use one of these and we don't waste any of our PRP. So any questions about the use of PRP and harvesting it through the VPET system, please feel free to come back to us. I hope this little short tutorial will help you get using this technology a little bit better, avoid some of the mistakes that people have made in the past. I know the lure lock on the actual filter has always been one of the areas which I've bumped up against, but otherwise I think this is a fantastic system for ambulatory equine vets to have in the car or the truck, so that if you've got a diagnosis which you're going to use PRP, it's as simple as get it out, treat there and then. For small animal practitioners, it's very easy. It can be transported into the operating theatre. Everything you've got is sterile, so that you can operate within the operating theatre, harvest the blood and process the PRP patient side and administer it again into articular environment. So thank you very much for watching. Do give me your feedback, and look forward to me processing other PRPs in the future through, we're going to be processing the harvest system, which is a centrifugation system, and the companion CRT system, how we process both of those to get optimal results. Thank you.